This video discusses how to become a healthcare assistant in British Columbia, Canada. We cover what you need to know before you enter the program and what the curriculum entails. So HCA programs in BC are usually about 6 to 7 months in length. Most programs require a minimum grade 10 English, although some require high school graduation with English 12. And many programs are highly competitive, so they'll often require related work or volunteer experience and interviews before being accepted. You will also need to pass a criminal record check and have your immunizations up to date and supply those to the program. And then you also need a first aid certificate with CPR HCP, which is the healthcare provider version. You need WMIS and you need food safe. So students often find these programs very intensive, so you have to be motivated to take it. It is not an easy program. Even students who have degrees going into the program can still find it challenging. So in BC, HCA programs have a minimum of 475 hours of theory and lab and 270 hours of practice experience, also called clinical. So that comes to a total of 745 hours of training. So the clinical experience is about 2 months. So the provincial curriculum was established in 2015 by the Carried and Community Support Worker Registry of BC. They recognize and accredit 39 different educational institutions. So those institutions collectively run 80 different HCA programs in the province. If the program is not recognized by this government registry, then the CARAID cannot work for any publicly run facility, as well as most large private run facilities. They will also require that you have the program and the registry number. So it isn't just the program you need to have, you also need to apply to the CACHWR to get your registry number. So most people choose to go to a public college, but you may find that there's wait lists and you don't want to deal with that, or you might have other reasons. You might choose to go to a private institution. So there is cost differences and they can be significant. Some of them can cost more than double. But you could justify it, because if you plan on working in a union situation, so in particular, if you're going to work for a health authority, work at a public facility, you're going to make $21 to $23 an hour. So you might be able to justify paying that extra tuition and getting out there as a carried in the workforce a year or two sooner. You're going to earn a decent wage. It's probably going to pay off, even if you are going to go to a private institution. And from what I've seen and heard, some of the private colleges have equally reputable programs when compared to the public institutions. I'm not saying that's the case with all, but some of the private ones, you will find you're going to get just as good an education. So if you're thinking about a program and you're not sure if it's private or public, you can just wiki list of colleges in British Columbia, and it'll tell you right there whether or not it's public or private. But you can usually tell just based on whatever the tuition is going to cost. I think for my program in 2015, it was $3,000-ish, and that was including my textbooks and everything. So well worth it. That paid for itself in only a few paychecks. So the topics that you're going to cover in the classroom, you're going to learn a lot about the various forms of dementia and how these conditions manifest. You're going to learn about other common medical conditions like diabetes, Parkinson's disease, Huntington's disease, heart and vascular conditions. And what you're really learning about is what to watch out for when you're caring for people with these conditions. You're not necessarily going to have to deal with them other than, maybe you might have to put compression socks on someone, but it's all going to be, it's the nurses and the doctors that are going to be just making the decisions around that. So you're going to learn as well about some mental health conditions and challenging behaviors. You're going to learn how your behavior and in the environment that you're in can affect the people that you're caring for, and what you can do to make your job and these people's lives more comfortable and safer and ultimately more enjoyable. You're going to learn how to become a better communicator. You're probably going to have to memorize some medical abbreviations. You're going to learn how to do some basic documentation. You're going to have to do some self-reflective journals, especially during your clinical practicum placements. You will cover a little bit on culture and societies, although I feel like that's an area of the curriculum that could use a little bit of tweaking, but overall it's a great curriculum. So you'll learn about issues of aging and how people view age in our society, ageism. You're going to have to write some papers and do some group presentations. So you're going to have to get up in front of your class, and you will have to write some exams. So if you have that grade 12, it's going to be to your benefit. If not, you're just going to have a little bit more of a challenge ahead of you. So you're also going to spend that 4 months or so that you're in the classroom. About a third of that is going to be in the lab. I don't know, a third, maybe that's a little bit of a stretch, but so this is where you're going to learn your skills. This is where you're going to learn how to bathe people, how to turn people properly in bed without hurting them or hurting yourself, how to toilet people, how to transfer them from the bed to the wheelchair, how to, practice safety, as I said, and infection control. That's a big one. And you'll learn how to feed people, how to groom people, how to dress people, especially people who maybe are immobile. And there's a great deal of importance placed on privacy because, of course, dignity is of the utmost importance. And you will have skills tests in the lab, and those are usually a pass-fail. So the skills tests, if you fail it, you fail the program. And occasionally people do fail. This is something that's taken very seriously. Usually it's almost always to do with safety. So if you're doing things that are going to make you unsafe, you're not going to pass your skills tests. But overall, most people do well in that area. So in the last part of the program is your clinical practicum. It's usually about 2 months, pretty much full time. And this is where you're taking the skills that you learned in lab, the theory that you learned in the classroom, and you're bringing it into the context of the workplace. You're consolidating those skills. You're tweaking them and developing kind of new little ways of making those skills more efficient and better. You're learning from experts. Some of these people have been carriers for over 30 years. Some of them maybe only a year, but they can still help build your knowledge. And you're going to get a taste of the various environments. So they're going to put you for a couple of weeks in community home support. And then you're going to do a couple of weeks in one facility and then a couple of weeks in another. If you live in a really small community, you might only go to 2 places. If you live in a large center, you're going to go to at least 4. So, and these people are potential employers. So, and this is where you are going to want to shine towards the end. You're going to want to show up on time. You're going to want to be properly groomed and presentable, not like these ladies right here with their scrubs dragging on the ground. But so this is some of the equipment you're going to be learning how to use. It seems very simple, but it's more complicated than it looks again. So these are both the same kind of bedpan. One's just metal, and then this is a slipper pan, bedpan, and a urinal. And we've got some commodes here. This one's actually a shower chair as well as a commode. So this is for somebody who is completely immobile pretty much, and it tilts back. It's got a headrest. I love these things. There's never enough of them. And then you've got different types of beds here, a stretcher. This is a very standard bed. This is called a high-low bed. So it's about a foot and a half off the ground when it's laying flat. That's for clients who maybe are at risk of falling. And then you'll learn how to walk with people and help them use their walkers. Some of them have like 4 wheels and they've got brakes on them. And this here is a Vernicare machine. This goes with the bedpans that are made of like a cardboard, and it just gets chewed up. So some of the facilities have that. And then this is a specialized bathtub, so it moves up and down. And there's a specialized chair that the patient sits in, and you lower them into the tub, and it's very cool. So there is opportunity for career advancement, not necessarily an increase in pay, but there is opportunities if you're somebody who likes new challenges or who wants to move in different directions. This may be something that you want to think about, but after you work for a minimum number of hours as an HCA, you can apply to take the acute care certificate course. I know it's offered at a few different places, and some programs are actually including this in their regular program, as well as some other additional certifications. So the acute care certificate program is about 2 months in length, and it provides training on performing things like simple wound care dressing changes, changing colostomy bags, which you will learn what those are in your program, emptying drainage tubes, suction holders from surgical drains, and maybe medication administration. But the medication administration is just from blister packs. That's also something that you would get. It's a couple days course, I think, if you become a worker with a home support worker. And you can also specialize in like foot care, and I believe you can. And there's also a First Nations focus. I think it's Camosun that offers that one, which I'm sure if there isn't already, there's going to be other schools offering it. So, and the other option is for people who are considering going into nursing. So becoming an HCA is a really good way to know whether or not this is something you actually really want to do. And there is an option to bridge in HCA to LPN. So that's normally LPN is a 2-year program. So I believe it's about 1.5 years that it gets shortened to if you bridge in from HCA. And there is a few places offering that as well. It seems to be a direction that many schools are going in. You cannot bridge from HCA to RN, but you can bridge from LPN to RN, although it does require, in the end, you're still doing basically a 4-year degree to become an RN. I chose to become an HCA before I became an RN, partly because I really wanted to know if this was something I was actually well suited to, and thank goodness, I believe I am. So the instructors for your program are registered nurses, and these RNs usually have experience in long-term care settings. They'll have backgrounds in a variety of practice experiences like critical care or home care nursing. Some of them have been medical surgical nurses. One of my instructors was actually an OR nurse, or operating room nurse. But all nurses have experience mentoring nursing students. So they're coming in having experience instructing as well. So, and I found too that likely due to this association with RNs, the HCA program tends to follow nursing principles. So things like person-centered care, holism, nursing ethics. So it's a really, really positive thing that the program requires the instructors to be registered nurses. So I hope this inspires you to look into taking a healthcare assistant program in BC. And I think that you'll find there's almost immediately jobs for you if you do decide to do it.